Our next speaker is Andrea Connors, as you see there, from the Patient Empowerment Network. She's got much to share, and I really want to hear more about digital Sherpa. And just a program note, Andrea, you've got your full 10 minutes, so don't worry about speaking too quickly. Take the 10. You're on, Andrea.
Great. Thank you so much, Cliff. Good afternoon, everybody. And thanks to NCCN for inviting me here today to present. And thanks to all of you for being here today and sticking through towards the end of the presentation. Next slide, please. So very briefly, for those of you who aren't familiar with us, I wanted to tell you a little bit about our organization, Patient Empowerment Network, also known as PEN, P-E-N. PEN is a national cancer advocacy organization that focuses on improving health literacy for patients, care partners, and families. But what really makes PEN different is that we take health literacy a step further. We provide free online programs and resources designed to educate and then help activate cancer patients and their care partners to really meaningfully share in the decision-making with their care team. We coach patients to proactively talk to their care team about their personal treatment goals. So I was really happy to hear the discussion that went on in the last panel. We do all of this because we know, as all of you know, that empowered patients typically achieve better health outcomes. So empowering patients and care partners isn't just in our name, it's at the heart of absolutely everything we do. Next slide, please. So now onto the program I was asked to talk to you about today. In 2016, we launched the Digital Sherpa program. The idea behind this program is to fill a gap that we identified in serving our network. I like to say that PEN was virtual before it was cool, or at least the norm to be virtual. We currently provide and have for many years the majority of our programs online via webcasts, videos, downloadable resources and guides, and also via social media and other digital platforms. However, research suggests, and our own experience certainly validates, that many older cancer patients and care partners, as well as those without consistent access to technology, really lack the basic internet and social media skills that they need. This really creates an obstacle when they attempt to access information about their illness, find support for themselves or their families, and join patient advocacy groups online. Often they become overwhelmed with the abundance of information and don't know how to or where to go to find help. Importantly, many struggle with how to identify credible sources of information. So as Danielle mentioned in the previous panel discussion, it's critically important that everyone is able to access the multiplicity of resources that are available online. And so we Patient Empowerment Network set out to address this disparity and empower the people we serve with really what we say the skills they need to become more tech savvy, or at very least able to utilize technology to their advantage during their cancer journey. So in 2016, we launched the first Digital Sherpa workshops to try to tackle the issue of health literacy, or digital literacy, excuse me. The program takes many forms and we've evolved it over time, but generally how it works is that program participants meet with university students who've been specially trained by PEN as digital Sherpas. The workshops are based on a set curriculum that we developed, and they're offered either individually or in a group setting. But regardless of how they're offered, the goal is always the same. And that's to teach participants about what the internet and social media can offer and how it can benefit their cancer journey in a fun and supportive environment. And I'm actually going to read a couple of quotes to you that kind of underscores that fun and supportive environment. So there's some actual photos here from Digital Sherpa workshops. And what always strikes me is how incredibly heartwarming and impactful these workshops are, not just because of the learning that takes place and the upskilling in terms of digital literacy, but also because it allows two generations to come together and really have a good time in each other's company, while, as I said, learning some of those very valuable skills. It's truly a win-win for everyone, this program. The students learn that they can make a tangible difference in another person's life with the tech skills they already possess as digital natives. And the patients and care partners learn how to empower themselves through the use of technology. So I wanted to share a few brief comments that we've received throughout the years from program participants. So this is from Annie, a 70-year-old breast cancer survivor. She said, "I enjoyed being able to interact with a knowledgeable young person for a couple of hours. It absolutely made my year." This next quote is from Jerry, a 60-year-old former journalist and MPN patient. He said, "My student Sherpa was exceptional in showing me how to use social media. She was knowledgeable, patient, and pleasant. When can I do this workshop again? Can you come tomorrow?" And this last one from Mary, a 72-year-old cancer patient, care partner to her husband, Mark. She said, "The casual atmosphere was great, and I appreciated being able to ask students about technology and not having to ask my adult children." And then just two comments from our students, our student volunteers. So this comment is from Ben, a student at UNC Charlotte. "I liked the connection aspect of the program and how close I felt to the patients afterward. It made me feel like they really valued the program and were learning about advocacy and networks that would really be beneficial to them." And then the last comment from Kira, a student at the University of Michigan. Kira said, "I loved the connection and bond we made. I learned so much and will forever have this experience treasured in my heart." And just a little note to add, this is Kira's third year volunteering with the program. So we get so many students who come back to us, even some of them after they leave university. So next slide, please. I mentioned earlier that the program has evolved over the past 4 years. We started the program with a workshop-based model in which we partner with other like-minded organizations, such as Cancer Support Community and Florida Cancer Specialists. This model is typically a shared responsibility model where Penn recruits and trains the student volunteers, retains the name, and the other organization promotes Digital Sherpa to their members and recruits participants. Penn then runs the workshop and provides an outcomes report to all of the stakeholders. We also maintain a closed Facebook group so that we have a place or the participants have a place to come back to after the workshops to continue to get their questions answered. And in tandem, we also offer the workshop via an embedded model at hospitals and cancer centers like Moffitt Cancer Center. In this model, students from USF Health are on 6-month rotations at Moffitt, volunteering as Sherpas and working with patients in their hospital rooms, as well as managing a help desk in the outpatient clinics. Next slide. So no presentation in 2020 would be complete, of course, without talking about how we pivoted this extremely high touch program due to COVID-19. So we were extremely fortunate to have already been working on a virtual version of the Digital Sherpa program called Digitally Empowered in collaboration with Pfizer. This is a screenshot of the homepage, and you'll see that the program is available in both English and Spanish. Next and last slide, please. So Digitally Empowered consists of 10 short, fun video modules that were developed based on our Digital Sherpa curriculum and the most common questions, barriers, and concerns that we've received during the past 4 years of offering this program live. Each video is less than 5 minutes and offers specific learning objectives, such as how to access the internet, the benefits of using your patient portal, and how to effectively use telemedicine. Each video has an accompanying downloadable resource guide and a very fun and short quiz designed to test for understanding if the learning objectives were met. This program is free and open to everyone. All it requires is a simple registration. So I hope you will engage with it. I've shared a handout, which hopefully will make its way to you, which gives you the URL and all the information you need. But we'd love for that program to be shared and make it accessible to everyone. So just in conclusion, Penn's working really hard to improve digital literacy, and we invite all of you to join us in that work. We love to collaborate, so please feel free to get in touch if you'd like to learn more. Thanks so much.
Andrea, thank you so much. And Penn is really doing such a cool thing with this digital Sherpa, starting with the name, of course.
Thanks.
But there are a couple of themes that really came out. One is that a lot of this is sort of cross-generational. You've got younger kind of techie people, like my kids, kind of working with people that tend to be older and are really looking for help. And that subtle point of, it's kind of good that it's not my child or grandchild helping me out. It's someone else, kind of more professional basis. And I really much appreciate that. But the cross-generational contribution is something we need. Obviously, we'd like to see more of that. And then the other thing is consistent with a theme we've heard throughout our day today, which is, and by the way, exemplified by what's still up on the screen, which is make it relatable. How do you translate the complex field of oncology with all the molecular biology and target therapeutics and all the diagnostics and so forth and complicated care plans into a patient guide, into a video, into providing advice for me a la Sherpa to help me kind of negotiate my way through this difficult journey. There's kind of a lot of marketing and communications and information sharing here. And it seems like the COVID pandemic is sort of kind of giving us all a kick in the pants to kind of accelerate this. And it's showing up so nicely in Penn and Digital Sherpa. So we really appreciate your input on that. Thank you very much, Andrea.
Thanks so much. Thanks, everybody. Take care.
Sure.